Hello everyone, my name is Nkwachioma Nwosu. I'm a psychiatric mental health nurse practitioner. I'm here to present my DNP project titled Falls Prevention Strategies Utilizing Bedside Reports and the 5 P's of Purposeful Hourly Rounding in Acute Care Setting. The committee members are Dr. Maria Snell, the DNP chair, project chair Dr. Tyrese Sanheinrich, second reader Dr. Rita Wunderlich, project preceptor Dr. Rani Thomas. Introduction. What is inpatient fall? Inpatient fall is an unintended descent to the floor. It occurs while a patient is hospitalized. Hourly rounding with 5 P's. What are the 5 P's? The 5 P's are pain, position, party, possession, and plan of care. Hourly rounding is a routine checking on patients. It is a regular time interval, assured patient needs are met. What is bedside report? Bedside report is a handoff communication method in healthcare where the outgoing nurse shares essential patient information directly at the patient's bedside with the incoming nurse. This process allows the patient to be part of the handoff, which improves transparency, communication, and patient safety. Bedside reports topically covers the patient status, treatment plan, recent changes, and relevant assessments. To address these challenges, a quality improvement initiative was launched. Bedside reports and hourly rounding were implemented to evaluate the patient's pain, position, quality, possession, and plan of care. And what are the benefits of bedside report? Bedside report increased patient's involvement, improved patient safety, enhanced communication. The problem that led to this project was that a 96-bed medical surgical unit located in the East Central region of the United States experienced a mean fall rate in the 4 acute care medical surgical units that are higher than the National Database of Nursing Quality Indicators benchmark for the past 12 to 24 months. Every year, there were many falls in the medical surgical units, the ICUs, the community living units, and around 120 inpatient falls occur annually, or 10 to 12 falls each month occurred in these areas. The background. Inpatient falls can lead to poor patient outcomes, increased healthcare costs, negative reputation of the hospital, decreased patient trust in healthcare system. Significance. Population affected are hospitalized patients. Around 1 million inpatient falls occur every year in the US. Fall costs increased hospital stays and enormous healthcare costs. Annual falls cost over 32.4 billion, and the estimated medical cost of fatal falls is estimated to be 637.5 million respectively. Costs of fall are not reimbursed by Center for Medicare Services. Question of inquiry. In older adults admitted in acute care at risk for falls, does the use of bedside reports and the 5 P's of purposeful hourly rounding compared to no use of bedside reports and 5 P's of purposeful hourly rounding effectively reduce falls. The purpose of this study is to determine if the implementation of bedside reports and 5 P's of hourly rounding would decrease falls post as compared to pre-implementation. The aim is to reduce the frequency of inpatient falls and the associated injuries while maintaining patient safety by focusing on at-risk veterans during the shift for immediate assistance. The objective is to educate, implement, monitor, examine, evaluate, and assess. During the literature review, 4 themes were identified and grouped according to the articles. They are safety, communication, fall reduction, and the non-patient safety. And to address the fall rate, these things must be explored to comprehend the circumstances leading to them. One is safety. Safety, hourly rounding enhances patient experience and safety, and it is justified by the idea that a strong nursing presence, prompt action, and responsiveness better meet patients' requirements. Communication to prevent falls. Good communication between the patient and the nurse allows for prompt attention to the patient's needs. And a study by Grimshaw 2020 concluded that communication was an essential component of the nursing bedside report to lower falls. And communication is a vital channel used in exchange regarding fall prevention and the reduction among hospital staff members and how they contribute to multifactorial fall prevention practices. Fall reduction. A study by Spano in 2019 examined how bedside shift reports and hourly rounding by nurses in inpatient setting can lower the number of patient falls. The study concluded that patient safety is increased and the implementation of the evidence-based fall prevention program such as bedside report and hourly rounding resulted in a notable increase in patient safety, indicating that organized and consistent bedside report and hourly rounding procedures are followed. The goal of these measures is to reduce falls. Patients, nurse patient safety. Structured communication has additional advantages like decreased falls and increased patient satisfaction. Hourly rounding aims to decrease potential risk, enhance patient satisfaction with healthcare, and give nurse dedicated time to attend to patients. And similarly, bedside reports enhance patient nurse satisfaction. The theoretical framework used for this project was the Lewin's change theory. And Lewin's theoretical framework fits fall prevention strategies utilizing bedside report and 5 P's of hourly rounding. The 3 stages of this change theory are freezing, change, and refreezing. The first dimension is unfreezing. This phase created awareness and preparation for change. This change involves education, training, and the exchange of information about the falls rates and related hazards. And it helped to raise awareness of this quality improvement project. And this first stage reflects the data collection period at baseline. Then the second stage, which is change, is what of the project. The primary goal of this stage was the implementation of the new intervention, which include falls reduction, utilizing bedside reports, and the 5 P's of purposeful hourly rounding. The third stage is rephrasing, which is the final stage of the project. As part of this regular practice, it is crucial to stabilize and reinforce modification after the strategies have been implemented. The nursing workflow was enhanced by including the 5Ps, which are pen, party, positioning, possession, and the plan of care, into hourly rounding to regularly assess and treat patient needs, including 4 risk factors. And my DMP intervention addresses these needs, particularly regarding prevention, using bedside reports and hourly rounding. Lowen's theory of change model guided the implementation of the 4 prevention strategies using bedside report and hourly rounding in many ways. Therefore, in improving safety, a nurse's job is to assist a patient who lacks strength, knowledge, or will to regain independence. Methods and design. The methodology employed quality improvement projects, utilized retrospective chart review, project and design. A hospital unit in the East Central region of the United States hosted the DMP project. The setting, it was an inpatient hospital in a cardiac telemetry floor of the hospital. This unit is a 23-bed unit and has experienced about 10 to 12 resident falls in 1 month. The participants include for documentation of all residents 18 years of age and older admitted to the unit within the 8 weeks of the project's implementation. All fall from the hospital JASPA IBA fall incident reporting system for the 2 months of pre-implementation from April 26, 2024 through June 26, 2024, and the post-implementation from June 27, 2024 through August 28, 2024. All these were included in the retrospective chart review. Method of evaluation. Microsoft Excel spreadsheet was used to examine the data. Data collection utilized the electronic medical record from the hospital's JASBA EVA fall incident reporting, and the pre-intervention I had for the 3 charts review. And data was gathered from April 25th, 2024 through June 26, 2024. Post-intervention 44 charts were reviewed, which began on June the 27th, 2024 through August 28th, 2024. The methods and design. These include the inclusive and the exclusive criteria. The inclusive criteria are fall incidents that occurred during the project's time frame. Fall incidents that occurred to a patient between 18 and 89 years of age. Exclusive criteria, fall incidents that occurred either before or after the project's framework. Fall incident that occurred to a patient either younger than 18 or older than 90 years of age. Fall incident was not a patient in the facility, such as a visitor. Fall incident was not an employee of the facility. Tools and data was used. Hourly rounding log was created by the researcher and used. Bedside report checklist was created by the researcher and was also used. This is the data collection tool, which is the Microsoft Excel spreadsheet used to collect data. This is the hourly rounding law that was utilized for education and used by the nurses during the implementation period to round hourly on the patients. And also the nurses were signed and they make a comment showing that hourly rounding was conducted. This is the bedside shift report checklist and signature log. This was used by the two nurses going to the room to conduct bedside report. The S-bar was used for bedside report, and at the end of the report, the two nurses will sign this, indicating that bedside report was conducted. And the instruments and procedure. This project utilized the Agency for Healthcare Research and Quality Strategy 3 Tools 3, 2 and 3 of the Nursing Bedside Report and the Health Quality Innovation Network tool was utilized. And these are the tools used for education and training the staff. Another tool for education and also for training the staff. This tool talked about the 5 P's of hourly rounding: pen, position, quality, possession, and plan of care. This is another picture and tool that was used. Purposeful hourly rounding using the 5 P's. So during the hourly rounding, we ask the patient for pain. How is your pain? Position. Are you comfortable? Do you need to be repositioned? Quality. Do you need to use the bathroom? And possession. Do you need your phone, call bell, bedside table, trash can, or water pitcher to be moved? And as the nurses were rounding, they make sure those things are close to the patient. Plan of care. Do you know the plan of care for the day? What the doctors are planning to do? Data analysis. So this is a quality improvement project and it employed statistical package for social sciences, SPSS. It also used Microsoft Excel for data analysis. It is also a descriptive statistics which were utilized to analyze data from the JASPA EBA incident reporting system from the hospital. The data analysis, it was a quantitative data, and overall I had 87 chart reviews. Retrospective chart reviews, I had 43 patients during pre-intervention, 44 patients during post-intervention. Each lasted for 8 weeks. The Z-test was run to determine the degree of significance between the pre- and post-intervention groups. And the result shows that pre-intervention with 43 charts review, I had 15 falls, which accounted for 39% falls. Post-intervention, I reviewed 44 charts and had 9 falls, which accounted for 21% falls. So if you subtract 21 from 39%, I have 18% decrease in false rate. Result summary. There was no statistical significant difference was found between the pre- and post-intervention groups after implementing bedside report and 5 P's of hourly rounding. The power was 0.443967. Z negative 1.5055. P was less than 0.05 and confidence level was 95%. The lower T's test and the directional form of the chi-square test revealed no statistical significance. However, there was a clinical significance with a drop in fall by almost half. So the total number of chart review was 87. Pre-intervention, 43 with 15 falls. Post-intervention, 44 charts with 9 falls. And the difference, 18% decrease in fall rate. So if the number would have been larger to power this better, I am sure that it would have met the statistical criteria. Limitations: nursing staff shortage, higher nursing turnover, high patient acuity, lack of time, and the need to prioritize charging by the nursing staff. Patients in isolation like COVID. Results was not statistically significant, like I said earlier, because of the small number of patients observed before and after the intervention. Discussion: the study outcome was comparable to previous fall rate. Pre-intervention, 43 charts, 15 falls equal 39%. Post-intervention, 44 chart review had 9 falls and equal 21% fall. Overall, 18% decrease in fall rate from pre-intervention. Education and the implementation increase collaboration, which decrease the fall rate. Nursing staff use the 5 P's hourly rounding checklist and the signed hourly. Many nursing staff utilize the bedside report checklist and signed on it. Nursing staff use of the bedside report shift checklist during every change of shift report by the incoming and outgoing nurses was a sort of barrier. The signature law created a sense of responsibility for the nurses who participated in the change of shift process. By signing the signature law, both nurses agreed that they had conducted the bedside report process. Effective communication is vital in enhancing the association between the patient and the healthcare team. Staffing shortage, lack of time was a barrier to implementation. The 3 stages of the Lewin's change theory, freezing, change, and the refreezing were completed, and some nursing staff were resistant to change. And implementation to practice. This project enhanced communication and patient safety, increased patient satisfaction and trust, reduced false rates and associated costs, improved accountability, enhanced team collaboration. Nursing shortage and high nursing turnover are taken into consideration when implementing this checklist in another unit. Conclusion: this quality improvement DMP project aims to bring a change by implementing the quality of care to reduce falls in acute care setting through a combination of strategies using bedside report and 5 P's of hourly rounding. This implementation of the evidence-based project found a long-term sustainable solution for reducing falls rates and showed that these strategies can help to reduce falls. Further research can examine how specific tailored intervention within the 5 P's framework impact falls rate and investigate how the effectiveness of this strategy varies across acute care and long term. These are the references used for this project. Another reference used. Any question at this time? Okay, I want to say a special thank you to my family for their unwavering love during this time of study, to all my friends, to Jody Shenok, all professors in this DMP program, Daniel Sivali Jibori, the nurse manager on 7A, all 7A nursing staff. Overall, I want to say thank you for taking the time to listen to the final presentation of my DMP project. Thank you all for all your help during this study. I really appreciate every one of you. Once again, I say thank you.